Professor Li Bassi, you're now almost 2 years since COVID pandemic emerged and the concept of long COVID has surfaced. What are we seeing in terms of general health and quality of life for people who have been discharged from the ICU with long COVID?
Thank you very much. Thank you very much for the interesting question. And well, let me start just acknowledging the organizer of this night, because it's a privilege to be here, and particularly among this brilliant clinician and such a level of expertise. So, in order to understand long COVID, in terms of the definition of COVID, if you are being discharged from the ICU and you have still symptoms after approximately 4 weeks from COVID, from the initial symptom that you had at home, very likely you are developing long COVID. If the symptoms are beyond the 12 weeks, you are developing the long COVID syndrome, which is something that we know very little about, and that was the main purpose of a study that we are running, so-called AfterCore. So for what we know at this stage, approximately between 5 and 10% of the patients who are hospitalized for COVID, they will develop some persistent symptoms, and the recovery of their organs will not be absolutely proficient. And if unfortunately you have a severe COVID and you're going to do the intensive care unit, that incidence increase up to 30-40%. We have an interesting early report from the Alfred Hospital that they've shown that 30% of their population from the ICU, they still have symptoms at 3 months after COVID. So in this context, if we look at, for instance, the United Kingdom, as we speak, there are already 100 clinics supported by the NHS in the UK in order to manage such a burden that we'll face in the upcoming years, because with a global pandemic, we will have several patients who will have long COVID in the upcoming years. In this context, John and I and other brilliant investigators, Dr. Wildy from St. Andrews and Dr. Swen that John mentioned from University of Queensland, develop a protocol that is called AfterCore that will follow up patient after the ICU discharge up to 2 years in order to understand what are the symptoms, what is the recovery of the organ dysfunction, and what will happen to this patient after they walk outside the ICU. And well, we had tremendous support from Wesley Medical Research, from the Prince Charles Foundation, University of Queensland, and we wouldn't be here without their support. But in terms of the network, this is something that is absolutely linked to the other network, the COVID-19 Critical Care Consortium network. We have at the moment more than 25 sites across 13 countries, across 6 continents, that they are describing patients with long COVID up to 2 years. Okay. And we are planning to present the first preliminary studies in the upcoming American Thoracic Society meeting in the United States. We still cannot say about the actual results, unfortunately, but let me tell you a story about what happened a few days ago. Of course, we sleep very few hours, and and I was on the phone at 3 a.m. in the morning with some collaborators in Argentina, and the main challenge in the inclusion of this patient was that there were many patients in their 50s without any previous medical condition, that after COVID, after ICU admission, they were not able to go back to the hospital to do the entire panel of assessment that we require for our study, because they cannot drive, they cannot use public transportation, and they are just with a condition that, as I said, we do not know the recovery, and we do not know. And unfortunately, these are patients, given that we have Pfizer here, these are patients that they were not so fortunate like we are to have the possibility to be vaccinated when they were affected by this disease. So let me conclude that, and thank you very much for the question.
Thank you, Dr. Li Bassi. You were also talking about the fact that your wife and you are expecting a child very shortly, so you'll be able to look after the child early during the evening hours, as well as answer telephone calls. Thank you very much.